So joining us now, we have Dr. Doug Brown. He is an infectious disease specialist at UC Health. So Dr. Brown, thank you so much for joining us.
My pleasure.
So this is a topic that I've been really curious about, and I know a lot of our viewers have been curious about: asymptomatic COVID-19 patients. So this sort of mystery behind being asymptomatic, I wanted to ask, we have both asymptomatic and pre-symptomatic. So first thing, what is the difference between the two?
So really asymptomatic means that you're not sick and you never become sick, while pre-symptomatic is that you're not sick now, you're maybe not sick at the time that somebody gets you tested, but then you get sick later on.
You know, let's start over. The camera was a little off. Sorry about that. So joining us now, we have Dr. Doug Brown. He is an infectious disease specialist at UC Health. Dr. Brown, thank you so much for joining us.
My pleasure.
So we're talking about this mystery of asymptomatic COVID-19 patients, and I know it's something that I've been really curious about, and so have our audiences. So we have asymptomatic individuals, but we also have pre-symptomatic individuals. Would you be able to explain the difference between the two?
Sure. So a pre-symptomatic person is not sick right now, doesn't have any symptoms, maybe at the time that they get tested, but then later on they do get sick and develop symptoms, while asymptomatic just isn't sick and they continue to stay that way.
And Dr. Fauci, I was reading something just recently that he said approximately 40% of people are asymptomatic. And this number, he said, was so high, it's alarming. It's something that he's never seen before with any type of disease. Can you explain why this might be? What do you suspect why this is happening?
Yeah, that's a really good question. Probably people who are asymptomatic are just more likely to maybe have stronger immune systems or just be a little bit less susceptible to getting sick from this infection than somebody else. And why that is still a good question for a lot more research. The other thing we don't really know is how common is asymptomatic infection with lots of other diseases. We maybe just haven't captured all of the possible times that people maybe are not sick with some other infection and don't know it. It's usually if you're not sick, you're not going to get tested or checked out.
That's interesting. So would an asymptomatic or pre-symptomatic individual be as contagious as, let's say, someone who has severe symptoms, severe complications? What are your thoughts?
Yeah, it's another really good question. It doesn't maybe have a definite answer, but I think probably people who are asymptomatic or maybe pre-symptomatic, probably they're less contagious than someone who's really sick, just because the main way that COVID-19 is spread is by these kind of big droplets, infected droplets that somebody maybe sneezes or coughs out, that kind of thing. So if you're not sick and you're not coughing or sneezing, then you're hopefully not spreading infected droplets.
Wow. Yeah, very interesting. And so this disease has been around in the US, gosh, let's say February. I don't know the exact date of the first confirmed case. It was January 23rd. But let's talk about sort of the long-term effects. There's research coming out that it's been long enough that patients have been infected with COVID-19. We've watched them for, let's say, these past 8 months after infection. And there is research coming out saying that there are potentially very likely long-term effects in terms of the lungs and the brain and the kidneys. Any thoughts on if a pre-symptomatic or asymptomatic person would experience the same sort of long-term complications?
Yeah, it's maybe not 100% certain, but I would say it's probably not really likely that you would kind of have long-term problems if you never actually get symptoms of kind of feeling sick in the first place. You know, can't say maybe 100% for sure. There's some studies that looks like maybe sometimes people who never really get sick still end up having maybe some changes on their lungs, like that you might see on, say, a CAT scan or something like that. But that does seem to be a little more uncommon. And I think in general, probably the people who are at more risk for having long-term problems are probably the people who are having more severe kind of illness in the first place.
So there's still a lot of research we need to do on this. We really need to watch this. So I'm going to give you the floor. Anything else you'd like to add?
I mean, I think in general, when it comes to asymptomatic COVID-19, it's good news for you if you're asymptomatic as opposed to being sick. That's certainly better to not be sick. Still maybe a good idea to do whatever you can to try to protect other people and protect yourself. I think all the general guidance that we're all probably really familiar with by now, kind of wearing masks when you're out indoors somewhere in public around people who you're not normally around every single day, washing your hands a lot, kind of doing the social distancing, all that stuff helps not only to reduce your own risk of getting sick, but to help protect other people from getting sick too, even if you don't have symptoms right now.
All of those measures that we've been, talking about since, the very beginning, I would guess. Well, Dr. Byrne, thank you so much for joining us, and we look forward to having you back on again soon.
Yeah, you're very welcome.